Hi, today we're going to be talking about pre and post-op care with regards to breast augmentation. Now the vast majority of breast augmentations are performed under the muscle now, with at least part of the implant being under the pec major muscle. The pec major muscle is also known as the pec muscle by a lot of people. With regards to going under the muscle for the implant, the reason for this is to, number one, help reduce sagging of the breast over time, and number two, to help reduce the imperfections in the implant being visible, such as rippling. Today we have Ken Lavander from My Online PT and Lavander Elite. Now Ken's had over 20 years experience as a strength and conditioning coach and has coached members of the Australian cricket team as well as the Australian police rugby team internationally. Now Ken, can you tell us a little bit about the pec major muscle and what it does?
So the pec major muscle is a triangular shaped muscle and it attaches from the clavicle and also the sternum. So it's used in most upper body exercises, and a couple of those would be a push-up and also a bench press. So it's used quite widely across any type of body weight exercise or in any gym.
So what you're saying, Ken, is actually anybody who is involved in going to the gym regularly is going to use that pec major muscle quite a lot.
Absolutely, yeah. It's very good for obviously pulling the shoulders back.
Yeah.
It's a major shoulder stabiliser.
Okay. One of the issues that we have with a lot of our athletic patients is that they have a lot of muscle tightness. And this is muscle tightness in the pec major. Obviously, with the implants that we put in, we put them underneath this muscle. And so the tightness of the muscle can actually affect how the patient feels afterwards with regards to pain. Also, the muscle can hold the implant up too high and stop it from dropping down to where it needs to get to. So it's really important that we get that muscle as soft and supple as possible so that we can have a really good outcome after surgery. Now, we're going to talk about the different ways to do that, and I think Ken is going to show us how to perform what we call a pectoralis muscle stretch.
So due to tightness of the pec muscle, what we want to do is 4 weeks pre-operative. We want to take you through a pec major stretch. So what we'll do with B, we'll bring your arm up at 90 degrees up against the wall, so even a door frame. Just from there, I'll just get you to lay into that stretch just at the end range and hold that stretch there just so you can feel that. Keep the shoulder down, and what we're looking for is a 20 to 30 second stretch. Now if you don't have a wall frame, one of the next best stretches are just by yourself. If you're standing or sitting, just come back off the wall for me, B. So we'll just clutch 2 hands together, just bring them in behind the back of the head there, and just lean back and just pull those elbows right back so you can see those pec muscles stretch, yeah, and get back to the end range, and just a nice supple stretch here, and just hold that stretch again for 20 to 30 seconds.
Thanks, Ken. That was a really helpful demonstration, and now you guys have an effective tool to help relieve the stress and tension in that pec muscle prior to your operations. Now, a lot of patients ask me, when can they go back to exercise after an operation like this? I tell them you can actually start walking immediately. We're not talking about power walking, we're talking about just taking it easy, stopping to smell the roses as you go along, and that can be done from day one after the operation. We want you to be active, we want you to get up and moving. The reason for that is because it helps reduce the risk of lung infections and also clots in the leg that can cause problems down the line. As for more strenuous exercise where you're going to get your heart rate up, we normally say 4 weeks because you're still prone to bleeding, and if your heart rate's up, you're more likely to bleed. More specific exercises like upper body, pull-ups, push-ups, press-ups, anything involving your pec muscle really needs to wait for 3 months after your operation because the capsule that forms around your implant isn't fully solidified until then, and so your implants can still be affected by how much you train over the next few weeks.